Physiotherapists are highly trained practitioners in treating and preventing a wide range of health conditions to help improve quality of life and encourage a healthy lifestyle. They provide tailored exercise and treatment programs for all members of the community, young or old, fit or challenged. Physiotherapy can help improve general health and well-being in many ways. Beyond the more commonly known treatments for sports and muscular injuries, there are many different areas of physiotherapy. Hello, my name is Christy Nicola, and this video aims to provide you with an understanding of the scope of pediatric physiotherapy practice, along with some of the commonly used modalities and referral pathways. Physiotherapists working within pediatrics provide therapy across a vast range of areas to children of all ages and diagnoses. The first area is gross motor. Children with poor quality of movement or difficulty mastering motor skills in line with their typically developing peers would benefit from physiotherapy assessment. Physiotherapy can then further explore the causes of these motor problems. In addition, physiotherapists are trained in assessing fine motor skills to determine if a child can perform at an age-appropriate level. Physiotherapists approach fine motor management differently from our colleagues in occupational therapy, highlighting the benefit for multi-professional management when required. Balance and postural skills are important as they give children the stability that is necessary to both learn and develop motor skills. Children who frequently trip or fall or have trouble standing or sitting steady and still, such that it impacts on their daily functioning, should be referred to a pediatric physiotherapist. Physiotherapy can also support children with a range of neurological problems. Differences in quality of movement, stiffness or floppiness, as well as any asymmetry in movement would warrant a visit to a physiotherapist working in pediatrics. Physiotherapists can assess, identify, and manage the persistence of infant patterns of movement. Examples of presentations can include children walking on their toes or adopting postures that reflect the persistence of a particular infant pattern. In addition to being experts in movement analysis, pediatric physiotherapists can both assess and treat the oculomotor, vestibular, tactile, proprioceptive, auditory, and motor planning systems in order to understand the impact these systems are having on the child's presentation. In adult care, it is common knowledge that physiotherapists are experts in managing musculoskeletal anomalies and injuries. This is consistent in pediatrics. When abnormal postures or alignments of bones are found, such as an in-toeing gait, physiotherapists can assess the muscle and bony systems with the aim to enhance function. Our area of expertise spans from problems identified at birth to musculoskeletal injuries or trauma sustained during childhood, or even malalignments that arise with growth, such as scoliosis. Children who have problems with their bladder and bowels, such as school-aged child still wetting during the day or at night, or soiling in their underwear, having recurrent urinary tract infections, or even constipation, will benefit from pediatric assessment and non-invasive treatment. Children who suffer from obesity, have poor fitness, or have been diagnosed with either an acute or chronic respiratory condition have been shown to benefit from physiotherapy intervention. Physiotherapists working with pediatrics can even assist children who have chronic conditions such as cancer. Physiotherapy may be required for management and control of symptoms, prevention of secondary complications, while aiming to improve both quality of life and functioning. Physiotherapists can also play a role in palliative care. Considering the large spectrum of symptoms pediatric physiotherapists can treat, it is not surprising that they can often collaborate with multi-professional teams with many professionals, including teachers, coaches, pediatricians, neurologists, and dietitians, to name a few. In order to address an array of symptoms, physiotherapists who work within pediatrics come equipped with a variety of evidence-based modalities, including education and advocacy rules, hydrotherapy, orthotics and equipment prescription, exercise-based treatment targeting sensory, neurodevelopmental, and musculoskeletal systems, casting, along with many hands-on treatment options, to name a few. Pediatric physiotherapy is an evidence-based profession which adopts current research guidelines to deliver optimal therapy to clients. Consequently, management is always goal-directed and family-centered, aiming to enhance the child's participation and quality of life across all domains from home and family life to community, school, and sport engagement. Depending on where you work, a referral to pediatric physiotherapist is as easy as providing your patient with a letter indicating the reason for referral and then encouraging them to source a pediatric physiotherapist near their home. Government agencies such as hospitals and child developmental services also have physiotherapy options available based on presenting conditions. Although a referral is not required, it is helpful and may be necessary to obtain certain funding. Funding is available for children and families dependent on the child's presentation and diagnosis. This can include national schemes such as NDIS, federal funding through Medicare, Department of Education, and private health cover. A physiotherapist will guide families on the best options to fully or partly fund physiotherapy services where eligible. Therefore, pediatric physiotherapists support children from birth through to adulthood, working collaboratively with many different health professionals to optimize a child's functioning, quality of life, access and participation in play, sport, education, and occupation. Remember to refer your patients to the Choose Physio website for information on how physiotherapy can help manage a range of childhood and adolescent conditions. To find a specialist physiotherapist, go to the Australian Physiotherapy Association website and click on the Find a Physio link.